To demonstrate the correct placement of the endotracheal tube, let's examine the gross anatomy of the pharynx and the larynx in a bisected cadaver.
Today's lesson will be on the anatomy of intubation. So let's orient ourselves. This is a bisection of the head and neck. We can start here by identifying the nasal septum, making this the nasopharynx, the hard palate, followed by the soft palate, and the uvula. This will be the oral cavity proper, and the tongue bisected. You can identify here the oropharynx, the posterior aspect of the tongue, the vallecula, followed by the epiglottis. You can now move further and identify the laryngopharynx. Here. This is the esophagus. And anterior to that is the trachea. You can identify the rings of the trachea here. We may also identify the true vocal cords and the false vocal cords. So that's our orientation. Now for intubation, we need to imagine this bisected head and neck supine. So when we begin intubation, we need to extend the person's neck so that the jaw will fall open. You may also use a scissor technique with your fingers. Place them here and here. And you scissor apart the jaw so you can visualize the oropharynx. This is a laryngoscope. You can see here, this is the handle of the laryngoscope, and this is the blade. This is called a Mac blade because it has a curve in it. Now when we have our patient's mouth open, take the tip of the blade, and we follow along the top of the tongue. At the same time, we're pushing the tongue out of the way so that we can visualize the posterior of the oropharynx. As we continue down the posterior aspect of the tongue, our goal is to place the tip of the Mac blade into the vallecula. Here. Once we're at this point, we can lift the jaw, and so that when you lift the jaw and point the tip into the vallecula, the epiglottis will raise up and move out of our way. Sometimes you can push hard enough that you can actually lift the patient's head off the table. You may now have a clear visualization through the oropharynx, into the laryngopharynx, past the epiglottis, and to the cords. Once you visualize the cords, you may take your intubation tube, follow along the path through the oropharynx, past the epiglottis, and past the vocal cords. Here, you may inflate the balloon, or the cuff on your intubation tube, and see if you're in the esophagus by looking at the CO2 on your monitor. If you don't see any end-tidal CO2, if you don't hear any air in the lungs during auscultation, you may have intubated the esophagus. Don't panic. You can always just remove the tube and try again. And that's the anatomy of intubation.
This now concludes our tutorial. We thank our donor for granting us the privilege to demonstrate this teaching video to you. We acknowledge Mr. Mark Savonia, manager of the Will Body Program, for his outstanding contribution to the teaching of medical students at Georgetown University Medical Center.